A new report released today by a nonprofit think tank claims to have found a potential solution to Canada's healthcare waiting list crisis. SecondStreet.org points to a healthcare policy in Europe that allows patients to travel to other EU countries for surgery and be reimbursed by their home country. The reimbursements would be of the same amount that the home country would have paid for local treatment. Well, joining us now to tell us more about this healthcare policy and if it's realistic for Canada to implement is Colin Craig, president of SecondStreet.org. Sir, welcome back to Forum Daily.
Well, thanks for having me, Nima.
So we know that Canadian provinces already reimburse patients for a portion of their planned medical costs abroad. So tell us a little bit more about this system and how successful it is.
So you're right. It does happen in Canada, but it appears to be a very, very limited number of people that actually get approved. It seems to be a very rare situation when someone actually is approved for this. Whereas in Europe, it's the opposite. It's standard for patients to be able to go to another EU country, pay for surgery, go back to their home country, and then get reimbursed for what that home country would normally pay. So last year, it was about 84% approval of applications for reimbursement in Europe, whereas in Canada, one lawyer from Ontario estimated that it was about 98% rejected in Ontario. So it's the opposite in Canada, and we think that if it was made a more standard procedure, it could help thousands of patients across the country get the care they need instead of languishing on long waiting lists.
Sounds like some significant differences between both systems, Mr. Craig. So what is the current state of Canada's healthcare waiting list system right now?
Well, we're in a crisis, and we were in a crisis before COVID came along. You know, we've been obtaining government data showing thousands of patients each year die before they even get a chance for surgery. These are patients that could have had their quality of life improved if they had had hip surgery, cataract surgery, knee operations, those types of things. But even some cases where patients died while waiting for procedures which could have potentially saved their lives. So things like heart operations. So we're in a very, very tough spot right now. That's why we think it's time to look at outside the box solutions.
And what kind of steps can our officials take to implement a similar system like the one that's seen in the EU? And would you say that it's an easy system to implement, Mr. Craig?
Well, it would be very easy to implement once a patient has a approval from the system that they need a particular type of surgery, whether it's a hip or knee operation. That part already happens. So once patients get to that stage, they could then decide to go abroad, get a surgery done at a facility that's qualified, of course, and then go back home and get reimbursement. And it's not just the patients that go abroad that would benefit. Every time a patient does that, those that are behind them in the waiting list get to move up a spot because now the government doesn't have to provide it using the public's system. So patients, whether you're traveling abroad or staying for the government, both sets would benefit from this type of proposal if it moved forward.
And I want to go back to your recent release on this. In it, you say that governments could also reimburse just a portion of these medical costs in this system, but how would that affect patients in terms of affordability?
Well, yeah, that's certainly an option. I mean, Europe does it one way. It doesn't mean we have to do it exactly the same way. So governments could approve a portion. And even then, that would still benefit patients because some patients right now are traveling abroad for healthcare. They pay for it privately, and that's it. They don't get any money from the government. Some look at that as an option, and then they decide, it's just a bit too pricey. Well, if the government even subsidized a portion of it, then certainly even more patients would decide, okay, I'm going to go for it. I'll pay for a chunk of it myself, and the government can pay for the other portion. So, either way, no matter how governments do this, I think that you would see less stress on long public sector waiting lists for surgery. And like I say, that would also benefit patients that don't decide to go abroad either, because they would then get to move ahead in the line.
All right, Mr. Craig, just about a minute left here, but how many patients' lives could be saved or improved by this new system, and who would qualify?
That's hard to say because it depends on the take-up and how governments structure it. But I think it's very easy to say we'd be talking about thousands and thousands of patients, because right now about a couple 100,000 patients at least every year voluntarily decide to go to other countries specifically for healthcare. So if there was some kind of financial support from the government on top, I think it's fair to say that number would increase.
All right, Mr. Craig, always great having you on Forum Daily. Thank you again for your time today.
Thanks for having me.